Okay, so here's a question from the Advanced Med Question Bank, and the question is from a radiology training interview panel. A patient receives the incorrect scan, what do you do? So we have a patient and they receive an x-ray or some sort of other scan, which is the wrong one. So this is a ethical, professional error type question. And there's a few ways you could tackle this question, but in terms of pulling together a properly well-rounded answer that covers all the bases, the framework that we recommend for this is the SPIES framework. S-P-I-E-S. Okay? SPIES, S stands for seek information or seek additional information, if you like. The P is for patients, and we want to be patient-centered in our approach. We tend to add the word safety there because generally there's a safety issue, but there are other patient concerns. Our I is for initiative, i.e. things that you will do to solve the dilemma, the problem. E is for escalate, so bringing it to other people's attention, particularly more senior people. And our second S is for support, so a reminder that rarely do these scenarios get dealt with immediately, and often we need to check back in and make sure people are doing okay along the way. So let's break that down. So we've got a patient, wrong x-ray. So the first S is going to be seeking more info. So what sort of information would we want to be seeking out? Well, I guess it may depend on the context. You know, have you just realized this and you're maybe part of the error chain, or you've discovered this in reporting, etc., etc. You would probably have a bit more time to pull some information. But what do we want to know particularly? Well, we probably want to know some things about the patient. Who are they? Where are they? Are they in the hospital, or have they gone home, for example? That makes a bit of a difference. What's their condition? Are they sick? Did they get the wrong scan and that's going to delay their diagnosis and treatment, etc.? Are they aware? Do they know what's happened? Okay, so this patient got the wrong scan, so clearly there was a scan intended for someone else. So we have another patient. So there's two patients. There's one patient and two patients. So all the same applies to the patient above. Now, did they swap over and have different scans, or did one just get the others and the other missed out? Again, how sick is this second patient? And then we have the family, and then we want to sort of maybe have a look and see, you know, why did this happen? Can we work it out from the sticker, the request, etc.? This might indicate who might be involved in the error chain. Usually it's a system of errors, but often there are one or two key individuals involved who are probably going to be upset when they find out that a bad error like this has happened. And then what's the protocol? What do we do in these situations? What do we need to do? And that'll lead to some of our other elements under the SPIES framework. So let's move on. Then we've got the patient, and as we see, we've probably got at least two, and we've probably got their families as well. So, you know, how are they? Are they safe? Do we need to call them back to get the right test done? If so, they're going to wonder why they're being brought back. They'll need to be offered an apology. There's a certain process for doing that, and they may well want to complain, okay, about what's happened, and that's perfectly okay for them to do. We would assist them in doing that, okay? So then we've got initiative. So what do you as the radiology trainee in this situation do? And usually that involves talking to people. You might have to, as I said, call one or two of the patient back to get the right test. You might be sort of first step in what's called the open disclosure process, which is the formal process of letting the patient and their family know that an error has occurred, and how we're going to investigate it as a hospital or service, and keeping them informed along the way. Normally that will generally fall down to the consultant to be involved in long term. Who are we going to also communicate with? The team. Tell them what's going on, okay? And then that leads us into escalation. So we've sort of highlighted some of the escalation points already. Clearly you would want to let your consultant know, and any consultant would want to be aware of a situation like this, and so they could come in and try and sort the problem out as soon as possible and make sure we're providing as good quality care as possible. So there's your consultant, but there's also the other consultant on the other team, or at least the registrar or someone on the other team. And then there are sort of management escalation points. So, and particularly we would want to consider the clinical governance requirements here. And so normally as a trainee, you would probably be involved in putting in an incident report, and there would be some sort of monthly meeting, usually a morbidity and mortality meeting, that this case would be reported to as well, and there'd be investigations, etc. And then finally we get to support. So who needs support here? So we've identified that we have patient 1, probably patient 2, hopefully there's not patient 3, plus family. Now, you know, that had an additional scan perhaps, or initially missed out and got their scan, and hopefully they're okay. If they've had an extra dose of radiation, that's not great. They may be very concerned about what that means for them. We need to provide some counselling support. They may want to put in a to complain about what's happened, etc. But the other key person in this scenario, or persons in this scenario, would be staff that were involved in the error. So, for example, this could be the poor, overworked RMO put the wrong sticker on the right form or the right sticker on the wrong form or something like that and caused the wrong patient to get a test, and they may be a bit upset and worried about what's going on, so they will also need some support, and perhaps they do need some counselling or instruction in terms of things they can do to prevent this occurring the next time. So that is how we use our SPIES framework to pull together the key points for answering a question like the one we have here: a patient received the incorrect scan, what do you do?